As you may be aware, Fraser Health Authority has announced publicly that they will be closing the evening clinics for mental health in 6 of the facilities around the Lower Mainland, around Fraser Valley rather, and one of them is Burnaby. And Burnaby has the second highest mental health population next to Surrey. So it will be a huge loss for this community to lose any services. We have touched base with our nurses here who work in both community mental health and acute mental health, and they're telling us that the caseloads are higher than ever. Sometimes their caseloads are running 70 to 80. They can generally only get in about 8 visits a day. The employer insists they stop booking appointments after 3:30. So if someone needs something at 4 or 4:30, they end up sending them to emergency. Many of the people who access these services would be working people, sometimes working poor, sometimes people with child care issues, with employers who just won't let them off work to go have an appointment at a day clinic. They need these evening clinics to maintain their mental health, their counseling, their medication regime, and this enables them to function normally in society, rear their children, maintain jobs, which is after all good for your mental health to be employed, and keep them pretty much living productive lives.
And you don't have to sort of anticipate happening if these cuts are, made?
Yeah, I think what will happen is that a number of people will simply fall through the cracks. They simply will not be able to access the day services no matter how much they increase them because they just simply can't get there. And there will be tragedies. And the sequelae of a lot of mental illness is family breakup, parents losing custody of their children, people whose diseases are being managed moving into acute phases of depression or psychoses. And with that can come erratic behaviors, aggression, but also on the depression side can also come suicide and other self-destructive things can happen. So we're very concerned that we're going to throw these people basically as it is out to the wolves, and it's not right in this society that the people who are the most vulnerable and most in need of our services have them left alone.
What would you propose then?
I would propose, if anything, that they at least maintain the evening clinics and increase our services to mentally ill. There have been study upon study done in provinces and federally about the need for more mental health services. Nurses across Canada have called on our federal government for a national mental health strategy for a number of years now, and nothing's been forthcoming. We really need to grapple with this as a society and put in services that will support people to manage their diseases in the community. Because if we can't, they're going to end up in our emergency rooms or worse.
Do you have any firm sort of statistics as to how many people are being cleared currently in the night clinics?
It varies. I know, for example, that at one of the Burnaby night clinics, they run 2 evening clinics where they see about 25 clients in group in each of those clinics, where they get their counseling, they get their medications, and they get their group therapy. So that's 50 people right there.
Anything else you wanted to add?
No, I just hope that the Burnaby Council is able to bring this forward to the Fraser Health Authority and advocate on behalf of their citizens, and maybe take it to the UBCM, which is coming up, because if this is happening here, I'm sure it's going to happen in other centres across the province as each health authority grapples with its shortfalls in their budgets.